Oral minoxidil works well for hair growth, but there's always been one major trade-off. This drug circulates through your bloodstream, which makes some people experience heart-related side effects like a racing heart and palpitations. But researchers have now tested another way of taking the exact same drug that could change that. It's called sublingual minoxidil. Instead of swallowing the tablet, you dissolve it under your tongue. And in a new study, researchers compared 5 milligrams of sublingual minoxidil directly against 5 milligrams of oral minoxidil for 24 weeks. Both grew almost the same amount of hair, but when researchers looked at heart-related side effects, there was a clear, significant difference between the two. And once you understand why that difference showed up, you'll have a much better idea of whether oral or sublingual minoxidil is a better option for you. Hi, I'm trichologist Bobby Spence. I'm a certified trichologist, and over the last 20 years, I've helped thousands of patients improve their hair growth and density. Now, before we go to why there's such a difference in heart-related side effects between oral and sublingual minoxidil, we need to understand how we got here in the first place, because most people don't start on oral minoxidil. They start on a topical version, and a lot of them end up in my office a few months later telling me it isn't doing much. That's one of the most common things I hear in my practice, because topical only works well for somewhere around 40 to 60% of people. The other half feel like they're just wasting their time. Now, there are two reasons for that. When you rub minoxidil onto your scalp, only a small portion of it actually makes it onto the skin. And even the part that does get in, it still has to be converted into its active form by enzyme in your scalp called sulfotransinase. If your scalp doesn't produce much of that enzyme, and a lot of people simply don't produce much of it anyways, then in that case, minoxidil never really turns on, no matter how religiously you apply it. And that's exactly why oral minoxidil became so popular. You swallow the tablet, and it goes straight into your liver, which is packed with the same enzyme that converts minoxidil into its active form. So as a result, you end up activating almost the entire dose before it even reaches your scalp, which is why oral tends to be more consistent in results than topical minoxidil ever did. So oral minoxidil solves this consistency problem, but it creates the exact issue I opened with. Once that drug is activated in your liver, it doesn't just head to your scalp. It circulates through your entire bloodstream first. In a small number of people, that shows up as low blood pressure, a faster resting heart rate, or every once in a while, actual palpitations. These side effects show up at a fairly predictable point rather than randomly. Researchers studying intravenous minoxidil, where the drug is delivered directly into the bloodstream, found that once active minoxidil drug levels reach around 20 nanograms per milliliter, the risk of cardiac side effects started to increase. With a 5 milligram oral dose, blood levels can briefly get close to that range. At 2.5 milligrams, they typically stay well below it, which is one reason lower doses tend to cause fewer problems. This is actually why often I'll have a patient split the dose, for example, 2.5 milligrams in the morning, 2.5 milligrams at night, instead of the big dose all at once. Spreading it out lowers the peak amount hitting your bloodstream at any single moment, and less of a spike generally means less strain on your heart. By splitting the dose only softens the problem, it doesn't remove it. If the real issue is that one peak number, the more interesting question is whether you could change how the drug gets into your body in the first place. So never build towards that peak at all. Now that it exactly is the problem sublingual minoxidil solves, a swallowed tablet like in the case of oral minoxidil takes the long way around. First the stomach, then the intestines, followed by the liver, and only then goes into general circulation. Whereas a tablet dissolving under your tongue skips almost all of that and is absorbed straight through the blood vessel lining your mouth. Or more of the minoxidil enters your bloodstream before being activated and can then be converted into its active form in tissues around the body, including the hair follicle. This keeps the peak amount of active minoxidil in your bloodstream much lower. In earlier studies, sublingual dosing produced peak levels around 1 to 2 nanograms per milliliter. Remember, the point where cardiac side effects start becoming more likely is around 20. So you're staying well below the range with sublingual minoxidil, but before anyone could recommend this route, this raises an important question. If the drug reaches your scalp still inactive, does your scalp actually have enough of that same transferase enzyme to switch it on? The exact limitation that holds topical minoxidil back for so many people. Now, that couldn't be answered from the mechanism alone, so it had to be tested in patients. A double-blind, randomized study from Brazil enrolled 110 men with male pattern hair loss in either 5 milligrams of sublingual minoxidil or 5 milligrams of oral minoxidil daily for 24 weeks. 85 of them made it through the full study, and their hair was tracked with actual phototrichoscopy imaging. For hair growth, the two groups came out almost identical. The sublingual group gained about 24.5 hairs per square centimeter, the oral group about 21.8, statistically having no meaningful difference between the two. The thicker, more cosmetically meaningful hairs improve at nearly the same rate in both groups too. And dermatologists reviewing the photos rated visible improvements in 42% of the sublingual group versus 40% of the oral group. So the enzyme concerned for a minute ago just holds sublingual back the way researchers thought it might. Now, this is where the two groups actually started to differ, and it comes back to the peak blood vessels we talked about much earlier. Heart palpitations showed up in 0% of the sublingual group and in 9% of the oral group. I want to be straight with you about what the study actually claims because a lot of videos on this topic oversell it. The researchers found sublingual works just as well for hair growth, and it's meaningfully safer on the cardiac side. This was enough proof to make sublingual minoxidil worth studying on a larger scale. And since the trial came out, there have been few developments, and I think they're worth mentioning because most videos covering the topic hasn't caught up to them yet. A company called Samson Clinical has already finished enrolling patients for a larger placebo-controlled phase 3 trial of sublingual minoxidil with results expected sometime around 2026. If it goes well, sublingual minoxidil could end up being one of the first newly approved treatments for male pattern hair loss in a long time. Currently, both the oral and sublingual versions are technically used off-label. There's also a separate trial that looked at sublingual minoxidil in transgender patients on a testosterone therapy who were dealing with pattern hair loss, and it held up well there too. So a broader review pulling together everything we know about topical, oral, and sublingual minoxidil lands on the pretty reasonable conclusion. Topical still deserves to be the first line option because it's the only one that's actually FDA approved for hair loss. Oral and sublingual minoxidil give dermatologists other options when topical isn't the right fit. But that doesn't mean everyone taking oral minoxidil suddenly has a reason to switch. If it's working well for you and you're not experiencing any side effects, I usually just leave it alone. There's very little to gain from changing the treatment that's already doing its job just because a newer option became available. However, if you had palpitations, a racing heart, or you just have always been uneasy about the medication passing through your entire bloodstream, sublingual minoxidil is a legitimate option to bring up with your dermatologist. And if you haven't started oral minoxidil at all because of the cardiac side effects, they're worrying you enough to hold off on it, this is genuinely a reasonable time to put it on the table with the dermatologist. One thing I'd add, because I get asked this constantly, this particular trial compared 5 milligrams to 5 milligrams. We also know a lower split dose lowers cardiac risk on its own. So the most cautious version of all of this, at least in theory, is a lower total dose, split across the day, taken sublingually. That combination hasn't been tested directly the way the 5 milligram comparison was, but it's a reasonable extension of what we do know. And like anything concerning medication, consult with a doctor who can look at your blood pressure and your heart rate directly before making any decision. Now that you understand how sublingual and oral minoxidil actually compare, it's worth remembering neither of them is your only option. There are other treatments out there with real evidence behind them, and depending on your situation, one of those actually may be a better starting point than either of these. I put together another video where I go through the most effective hair loss treatments and rank them based on what the evidence actually shows. So watch this next.